Duvelisib.
Inositol or inositol 3 kinase delta inhibitor, phosphatidyl inositol 3 kinase gamma inhibitor, anti-neoplastic agent used for the treatment of relapsed or refractory chronic lymphocytic leukemia or small lymphocytic lymphoma in adults after at least 2 prior therapies. We should also notice that pneumocystis jirovecii pneumonia or PCP prophylaxis should be provided during treatment. After completion of the therapy, continue PCP prophylaxis until the absolute CD4 plus count is more than 200 cells per microliter. Consider providing prophylactic antivirals during Duvelisib treatment to prevent cytomegalovirus infection or reactivation. Treatment pre-existing infections prior to Duvelisib initiation. U.S. vaccine warning: fatal and serious infections occurred in 31% of Duvelisib treated patients, and fatal or serious diarrhea or colitis occurred in 18% of Duvelisib treatment, and fatal or serious cutaneous reactions occurred in 5% of Duvelisib treated patients, and fatal or serious pneumonitis occurred in 5% of Duvelisib treated patients. Duvelisib Safety Alert, June 2022. The FDA is alerting patients and healthcare providers that the 5-year survival results from the DUO trial comparing Duvelisib and ofatumumab for the treatment of chronic lymphocytic leukemia and small lymphocytic lymphoma found Duvelisib was associated with a possible increased risk of death and a higher risk of serious side effects including infections, diarrhea, inflammation of the intestines and lungs, skin reactions, and elevated liver enzymes. Duvelisib is an oral PI3K inhibitor with dual inhibitory activity against the PI3K delta and the PI3K gamma, which are expressed in hematologic malignancies. Inhibition of PI3K delta prevents survival and the proliferation of malignant beta cells, and the inhibition of PI3K gamma reduces differentiation and migration of T cells and macrophages that support malignant B cell maintenance. Duvelisib resulted in reduced viability of cell lines derived from malignant beta cells and CLL cells. Additionally, Duvelisib inhibits beta cell receptor signaling pathway and CXCR12-mediated chemotaxis of malignant cells, as well as CXL12-induced T cell migration and MCSF and interleukin-4-driven M2 macrophage polarization. Volume of distribution: 28.5 liter with 98% of protein binding. Metabolism is mainly hepatic through cytochrome B3A4 with 42% bioavailability and half-life elimination 4.7 hours and time to peak 1 to 2 hours. Excretion mainly through feces. FDA approval date is September 24th, 2018.